Today's conversation focuses on the importance of storytelling in advocacy. Today's Cafecito is part of a series where we will be highlighting our storytelling initiative, Voces de los Mayores, in partnership with the SCAN Foundation. We are excited to welcome our guest speaker for today's Cafecito, Dr. Sarita Mohanty, President and Chief Executive Officer of the SCAN Foundation, one of the nation's leading philanthropic organizations dedicated to improving the quality of health and life for older adults. Under her leadership, the SCAN Foundation has embraced a bold vision, shaping a future where aging is inclusive, equitable, rooted in community values, and emblematic of true lived experience. We are also joined by Dr. Yanira Cruz, President and CEO of the National Hispanic Council on Aging, and one of the nation's foremost advocates and spokespersons for diverse older adults. Today, Dr. Cruz will moderate the conversation alongside with Dr. Mohanty. Dr. Mohanty and Dr. Cruz, thank you for being here with us today.
Dr. Mohanty, good morning. It's great to be here with you, having this conversation about the role of stories in our lives and in our work in the field of aging. I would love to, hear from you on what is your perspective from a philanthropic point of view. How can storytelling help shape policies and programs that impact the future of aging in today's society?
Thank you for the opportunity to participate in the Cafecito. This is great. The foundation is really grateful for the opportunity to partner with the National Hispanic Council on Aging and elevating the voices of people with lived experience. So really appreciate the partnership. And the SCAN Foundation's mission is to ignite bold and equitable changes in how older adults age in home and community. And we do this through grant making, policy, and mission aligned investing. Really the goal really is to amplify the voices of those who interact with our health and aging systems. Across the work, we focus on serving older adults of color, those with lower and middle incomes, and those that reside in rural communities as well. So what I've learned in terms of our role in philanthropy, and it starts actually with my career as a physician as well, I've learned that effective care really begins with listening. And clinical expertise can be important, but people's lived experiences should inform the decisions about their care. And that same principle applies to philanthropy and policy making. Philanthropy can fund innovation, and it can also help really reshape how we understand the aging experience. Because we live in this culture that really, overemphasizes individualism. And the mindset seems to extend to aging, that's an individual responsibility. The caregivers, that's their responsibility. But aging, we say constantly, is universal, and it's one of the defining demographic realities of our time. And so stories grounded in that true lived experience can help people see the urgency of aging issues and imagine what could life be like? What are the new solutions that could help everybody age well with purpose and with dignity. In philanthropy, these stories can help make systems more responsive to people. So I'll just say one quick example of how philanthropy like ours is really elevating storytelling is through efforts like the People Say. It's a resource that we've developed with the Public Policy Lab that brings older adults' lived experiences into policy conversations, the platform where you have all these stories and making those insights more visible and accessible. And so that helps the stories become more normalized, new ways of thinking, helping people see themselves, truly in those issues. And that shift is often what creates that the public will is what is needed for meaningful policy change.
Thank you for the work that you are doing at the SCAN Foundation, especially with this notion of making sure the voices of older adults help to drive some of the policy issues that are so critical in today's world, and especially as the population ages and more people become older adults. And as I hear you talk, I think of why is it important for older adults to lead and define their own narratives, rather than having others speak for them when shaping the future of aging.
I think too often we see that health and aging policies and the systems seem to be always or often designed from the system's perspective. The payer knows what the patient or the individual wants. And philanthropy says maybe they know what people want. But the actual experiences of people navigating them remain invisible often and really unconsidered. So those stories can actually help reverse that dynamic because people's lived experiences bring that humanity and also that immediacy to the issues that might otherwise feel distant or abstract. So they help people understand the real challenges of navigating fragmented systems. It's hard to articulate that if you're not in the, experiencing them yourself, right? And if government policies and healthcare delivery systems are to reflect people's needs, we have to elevate what the public actually wants and create that pressure for regulators, for providers, and payers to respond. And our work with NHCOA and the People Say are just examples, and they're meant to connect policy discussions to what older adults and caregivers are actually experiencing in their daily lives. So, kudos to your organization for what you're doing to raise that awareness and bring those voices to the forefront.
You make such an important point here, in that humanize the issues that we're working on is so critical, because sometimes we get caught up in the numbers, we get caught up on politics, and behind every policy there's a human being, right? Through these stories that we are supporting, and we're helping to make that a reality, humanize the issues that we care about. So I think it's wonderful. And in what ways do you think philanthropy can continue to better support spaces where older adults, especially those from historically underserved communities, can share their stories, can continue to be empowered?
What's interesting to me about this question is this idea, I think, of creating space for storytelling. I think that's really important. That's really what's interesting to me. In our work, that really means not just inviting people to speak, but also addressing the barriers that make participation difficult. So let me give you an example. We've seen this in our support for what we describe as our equity community organizing groups. We support those at the SCAN Foundation. These are organized groups in California right now that are in different geographies, rural, urban, suburban, and they are they are actually convening older adults and the community at large to identify the core issues that older adults face and how can they activate solutions, policy solutions, programmatic solutions. So this is where storytelling only becomes possible in these equity community organizing groups or eco groups, when communities also have language access, they have trust, and they have consistent opportunities to participate. The example that comes to mind is access. So one of the groups, our eco groups, is Cloverdale, California. It's made up of predominantly Spanish-speaking farm workers. And these residents, interestingly, have identified concrete aging-related priorities in their community. But their ability to influence the local decisions is limited because when they go to city council meetings, these council meetings consistently do not offer translation services. So this points to something even larger. Even when there is interest in hearing from communities, the question is often whether the system is even equipped to hear them. And that's what we've been finding. So philanthropy can help. And we've actually helped in investing in translation, culturally responsive engagement, sustained participation. So they're not just one-time listening sessions, because those are the kind of things that philanthropy and others can do to try to reduce those barriers so people can really elevate their voices.
That's great. That's a great example. And I think we have to be intentional. And I applaud, you and the Scam Foundation and who are sort of opening new doors and new ways of, shaping the landscape and the policy conversations so that more older adults can also have an input. And in this process, wondering, what ways can storytelling can help challenge stereotypes about aging and reshape the negative narrative surrounding it. Ageism we know exists and is very much alive. So how can we use storytelling to address some of that?
Storytelling, as we've talked about, has such enormous power because the stories we tell as a society shape what we value, what we fear, and also what solutions we're pursuing. And that's one reason the Scam Foundation has supported the National Center to Reframe Aging, whose work helps the field move away from this deficit-based view of older adults. That there's a lot of negative connotations about aging. But we want to really, flip that on its head. Talk about this fuller, more accurate story about the aging experience. So their research reinforces a core truth. The truth is that the language and the words to talk about aging really matters. So that language and the stories we tell can either reinforce, division, or it can foster understanding, connection, collective responsibility. And that reframing matters even more now as states are developing these multi-sector plans for aging, which require real true public understanding and broad support to succeed. And many states have effectively communicated that these plans are not just for older adults, for example, these multi-sector plans for aging, but for everyone. Like all of us are aging because aging is a universal experience. So that's key, right? And ultimately, when we reframe aging, we begin to replace that fear with more possibility and purpose. And that shift in thinking is critical to, again, that goes back to that public will, which is needed for long-term change. So that's really an example. And I think, again, as we hear the stories of older adults and their experiences, not just what's not working, but what is working well, I think we'll start to really develop those long-term solutions and make some real effective change and shift the narrative at the end of the day.
Your closing points in that aging applies to everybody, right? It's first of all, we're all constantly aging. Right? From the beginning, from the moment we're born, we are aging, we get older, and we go through phases and we go through changes. And eventually we'll either take care of a parent or a grandparent or a tia, or we ourselves are going to get there, right? So it behooves all of us to care for those who took care of us. And so I'm just grateful to you, Dr. Mohanty, for what you do, for what you represent, and as a woman leader, I applaud you for dedicating your time to helping those who need to be seen. So thank you for everything you're doing, and this concludes our interview.
Thank you so much. Appreciate the time.
As we finish today's Cafecito, we thank you all for joining us today to learn more about the importance of storytelling in advocacy and how it helps to shape the policies and programs that impact our society. We thank our guest speakers, Dr. Mohanty and Dr. Cruz, for joining us today and empowering our community to be their best advocates. We hope that today's discussion leaves you with an understanding of the importance of participating in storytelling initiatives, the importance for older adults to lead and define their own narratives. We invite you to share this edition of Cafecito con NHCOA with your family members, friends, and community. And don't forget to stay connected with us through our digital platforms and social media via @NHCOA for more resources, updates, and future events. Until the next Cafecito con NHCOA, see you then.